Hello friends, welcome to channel Think Pedia. Thank you for watching this video. In this video, I'll be describing you 11 important points which nurses should daily look into each and every their pediatric ICU patients. As its studies have shown that if you look after these points daily in all your ICU patients, chances of positive outcome increases dramatically. So there is a mnemonic for that which we train our nurses and daily to have a look on. So mnemonic is like fast, hugs, bid. So FAST, fast, HUGS, hugs, and the BID. So I'll be describing all 11 of them one by one. First is F. So fast means the first F. F is for feeding. As we all know that nutrition is most of the time neglected in the ICU management. So feeding is very important. So nurses should daily ask their consultant that if the feeding is not going, then whether to start feeding or escalate the feeding or what. A and S is for analgesia and sedation. So those patients who are ventilated, they go on heavy doses of many analgesic as well as sedative drugs. So daily sedation holidays is important, and it has shown to improve the outcome. Mortality reduces and chances of VAP decreases also. So FAS, and fourth is T. So that is thromboprophylaxis. Though thromboembolism phenomena is not that common in pediatric population, but still those who require prolonged immobilization and ventilations like patients of GBS, even thromboprophylaxis is important. Either you can use unfractionated heparin or compressed stockings or physiotherapy to prevent the thrombosis and embolism. So fast and then hugs, HUGS and S. So H is for head and up. Unless patient is in shock, always have a habit of keeping the head end up. Even VAP chances reduces if you have head end up, because the secretion does not pull into your respiratory tract. U is for ulcer prophylaxis. Many studies have shown that ulcer prophylaxis at times, so you have to review the need of ulcer prophylaxis. At times it goes endlessly without being required. There are very certain indications where you can consider continuing ulcer prophylaxis like pantoprazole, omeprazole, or whatever you are comfortable with. HUG, G is for glycemic control. So sugar has to be recorded daily or as and when based on the situation of the patient, and that has to be charted in nurse's chart and has to be reviewed by the consultant. HUG, and then is S, hugs. So S is for very important, it's a spontaneous breathing trial. So daily give your patient a chances of spontaneous breathing trial. There are certain indications for that. There will be different video for that, and I'll ask you to go through that also. But then if those criteria are met, always have a habit of giving sedation holiday and looking for spontaneous breathing trial. So that will reduce your ventilatory days, morbidity associated with the drugs which we use as sedation, as well as on long-term mortality. So fast, hugs is done. Then is BID. So B is for bowel and bladder. So your urine output, stools output, any those things has to be charted in nurse's chart. I is important. It's invasive devices as well as implants. So all invasive devices inside the patient has to be daily reviewed, the need of those devices. For example, central line, arterial line, for example, nasogastric tube, Foley's catheter. So if there is no need, so daily nurses should ask their consultant, is this required or not? Like, can we get away with the central line and start on the peripheral venous if possible? So that is nurse's job to bring attention of their consultant about the invasive devices. Also, the site of the invasive devices has to be looked for. Signs of infection, if they need any treatment, has to be done. So that again comes nurse's job to have a look at those sites. And D, very important, last is de-escalation of antibiotics. It's very common practice. We start antibiotics, but then we don't take decision based on our culture report, and then those, if we have out of desperate situation, we have started higher end antibiotics, we are scared of getting it down. And so always de-escalation of antibiotics again is important. So remember, fast, hugs, bid, FAST, HUGS, hugs, and bid, BID. So it will help as a doctor, it will train your nurses for these things, and I'm sure it will help. Thank you. Please do give your suggestions.